Okay, we're getting ready to call Phyllis. Yes, may I speak to Phyllis, please?
Hello?
Yes, Phyllis?
Hi.
Hi, is this Phyllis Van Santen?
Yes?
Hi, this is Dr. David Allen. I need to talk to you for a second if I could.
Sure.
We need to see Brent, and he's locked in his house. So
We don't,
we need to have you come over. I'm sorry. Excuse me. I'm sorry.
ordering drugs or marijuana or something.
Ma'am,
Are you a
ma'am, listen to me. You have this patient locked in his house, and I need to examine the patient. Can you come over here?
I'll have to call him and see what he says because I'm
If
not letting
you
in just anybody. I have to know what your business is because he's under a doctor's care. He's under antibiotics. His blood, his urine is full of blood. He's a sick man, and he's at times confused. And I can't have people coming in there that I don't know what's going on.
Okay, are you his nurse?
Yes.
All right, and you're paid by who pays you? The government?
Listen.
All right. Well, listen. We're right here, and if you don't come over and open the thing, we're going to call the police.
Yeah. Well, I have to know what your business is.
You have to allow us. If the patient wants to see the doctor, you have to allow that to happen. Otherwise, we're going to call the police.
Are you a doctor?
I'm a physician.
Well, I'll come and open the door for you.
That'd be very good. I wish you.
Under the care of
I understand. He has called me and wants to seek my advice, and I'm going to talk to him. And I want you to come over and open the door now because he told you to open the door, and you deliberately locked the door.
Yeah, because he brings in drugs.
He brings in drugs.
That's worthy.
What kind of drugs does he bring in?
Any street drugs, anything he can get.
Like what kind of street drugs are you talking about?
Marijuana
Marijuana or whatever? Well, you know marijuana is legal to use in California by democratic vote. It's a legal medication.
He's not capable of smoking anything.
Well,
because he had a fire.
we're not saying. Listen,
Huh?
we need to see the patient. If you do not come over here, we're going to call the police.
If you're a doctor,
All right. How long will it be before you're here?
About 5 minutes.
All right. Thank you. All right. Bye-bye. Wow, that was an amazing conversation, wasn't it? It looks like this nurse is trying to prevent her patient from getting medication because she has a particular view of how medication should be given, and she's prejudiced and doesn't understand that this man could actually benefit from cannabis and not have the side effects from a lot of these medications that he's on. So what we're here to do is we're here to help this man, and I'll do a mental exam on him, and if he's competent, we will get medication to him. Now, if he's unable to use fire, if he can't smoke, then we'll get edibles to him or whatever he needs, or a vaporizer. And so they can't deny him medicine just because he can't light a cigarette. And we will get medicine to this man if he needs it. Now, she's got a different kind of doctor here now, and I don't scare easily, and I have a film crew, and she doesn't. I think that she can't be mean, and she can't deny you rights. And cannabis is a legal medicine that you can use in this state, and has the same legal status as any other medicine. And she said, well, he does, he's bedridden, he can't smoke, he'll be a fire hazard. Well, there's other ways. There's vaporizers that you could use that would do the same thing, and it wouldn't have any smoke at all. So there's a lot of options for people that are invalid, that they can still use this medicine, and it's better than any other medicine that man has made so far. So, and I'm sure that once we talk in there, that you'd be extremely happy with this whole situation. Okay. All right, so we're just going to wait outside until she shows up. Oh, looks like she's showing up right now. And all right. All right.
Thank you.
All right. I'll see you in a minute. Bye-bye. First off, it's illegal to lock a
Right.
patient in a house like this.
This is illegal.
That's illegal. If he had a fire or something like that, it would be a major problem. And she's already told me that she's trying to prevent him from access to cannabis because cannabis would
What's cannabis?
cannabis. That's the problem. You don't understand what cannabis is. If you understood what cannabis was, you wouldn't be so negative about this. And so it's a plant, it's God's medicine that helps millions of people. If he wants to use this medicine, he has the legal right to use it in this state, and no person should deny him that right. It's going to be better for him than any medication that he could get from the other doctors, and we would like to discuss this with you. Are you willing to discuss this with us?
Phil, let's get out of here.
Come on.
I'm asking you a direct question. Are you going to prevent me from seeing this patient?
Why? What is this? All this denying and stuff? I don't.
Are you
get
gonna
that.
open this door
I don't
and let us
get
see
this.
it?
But
You got it.
where have we been
All right.
denying him to see
All
a
right.
doctor?
Do
If
not
you
do
don't
We don't
open the
even know
door,
anything
if
about
you don't
it.
open the door,
All
I'm
of a
calling the
sudden,
police.
you come on the scene.
I'm calling the police if you don't open the door. The police are going to make you open this door. Well, I would love the police to show up. You'll be on CNN tomorrow.
What kind of people are you?
What kind of people are you trying to prevent this invalid from receiving medicine? What's the matter with you? What is the matter with you? This is legal medicine and he has the right to
Hey.
use this.
Hey, get your hands off
What are
of
you
this
doing?
doctor.
You can't touch me.
I just touched you.
Call the
I'm
cops
saying-
right now. I'm calling the
No,
cops.
no, no,
I'm saying,
no, wait a minute,
Why
stop.
is why
Open
all
the
of a
door,
sudden are
or
we
we're calling the
telling-
police.
We're
Open the
denying
door,
him a doctor.
or
we're
we're
denying
calling the
him
police.
this. We're not denying him anything.
You're denying him to be seen by a doctor, and I'm going to call the police if. All right,
I'm doing it right now.
all right, do it,
Done.
do it. You guys are
Yeah, what
are
is this
so
people talking
uneducated about this subject.
What are we gonna do, fella?
You guys need to come in here and listen to
They're
this.
druggies. They're druggies.
We're not druggies.
Don't
We're
get the
not
man in
druggies.
here. You are druggies.
We're not druggies. I'm a
Druggies
retired
are
heart
like that.
surgeon. I
don't
I
care
am not a
if you-
druggie.
you
You
are
guys
a
don't
druggie.
understand this.
You are a druggie.
And you work for the government, and I'm going to
are
have
a
you
druggie.
fired.
This man opened the door. They had an invalid patient. In
Hello, Brent. Is it okay if we come in?
His name is Brent. He's an invalid. He can't get outside. They had him on.
I'm Dr. David Allen.
Is this all you're doing, Brent?
Yeah. Yeah, it is, and it's his right.
No, I
It's his-
was asking him.
Well,
I
I'm
didn't
going to tell
ask
you.
you.
I'm going to tell you because you seem to have a problem to understand, and I want to try to educate you the best
Well,
I can.
out of the blue, you guys come out of the blue and nothing.
I would like to educate your wife too because I think she really needs some help in understanding what this problem is. And maybe if you understood what the problem is, you wouldn't have the opinion that you do now.
Well, I don't have an opinion. I just
Well,
got
no,
guys
your
with
wife,
cameras and
your wife
taking
and
my
I,
picture and
your wife was
threatening
calling.
and going to call the police and
Yeah.
we're doing illegal stuff and it just goes on and on and on.
All right,
It's
well-
out of the blue.
What we're here today to do is to help this gentleman get medicine that's legal to use in this state.
Come on, people.